presence data demonstrating established, investigational HIV drugs. Data from the Alliance trial showed bictegravir, emtricitabine, and tenofovir alafenamide, BIC-FTC-TAF, Biktarvy, maintained high rates of suppression for HIV, 95.4%, and hepatitis B virus, HBV, 86.6%. For 89 patients who switched to BIC-FTC-TAF treatment with dolutegravir, emtricitabine, tenofovir disoproxil fumarate, DTGF/TDF, according to data presented at the Conference on Retroviruses and Opportunistic Infections 2025, in Alliance, NCT 03547908, investigators aim to evaluate Biktarvy compared with DTGF/TDF as HIV and HBV treatment for patients that are co-infected. Patients received either Biktarvy or DTGF/TDF once daily for 96 weeks. In the open-label extension, individuals continued to take their blinded drug until the end of the treatment period for up to 48 weeks. The primary outcomes included percentage of individuals with HIV RNA of less than 50 copies/ml at week 48 and percentage of individuals with plasma HBV DNA less than 20 IU/ml at week 48, according to the clinical trial data. Secondary outcomes included the percentage changes of both primary endpoints at 96 weeks. In previous data, both endpoints were met for non-inferiority, with 95% of patients receiving Biktarvy and 91% receiving DTGF/TDF meeting the HIV endpoint and 63% and 43%, respectively, meeting the HBV endpoint. As for treatment-related adverse events, AEs included 29% for Biktarvy and 28% for DTGF/TDF. According to the study authors, in the Biktarvy group, one patient reported a serious AE related to treatment. 3. In the new analysis, 19% of individuals reported AEs, which were mild to moderate in severity and led to 0 discontinuations. The most commonly reported AE included weight gain, 9%, and low-density lipoprotein cholesterol increase, 3%. Furthermore, Gilead also presented primary results of a Phase 2 study, evaluating investigational lenacapavir, teripavimav, and zinlervimab, LTZ, which confirmed the previously presented Phase 1b results. These results showed that 90% of patients who completed the study regimen maintained virological suppression at week 26, and no serious adverse events were seen, including AEs that lead to discontinuation. In the Phase 2, NCT 05729568 study, investigators aimed to determine the effectiveness, safety, and tolerability of LTZ for virological suppression in adults with HIV. LTZ was compared with oral antiretroviral therapy, ART, according to the clinical trial information. The primary outcome included the proportion of individuals with HIV RNA of 50 copies/ml or more at week 26. Secondary outcomes included proportion of patients with HIV RNA of 50 copies/ml or more at 52 weeks, proportion of patients with RNA less than 50 copies/ml at weeks 26 and 52, and proportion of individuals experiencing treatment-emergent AEs. At 26 weeks, 96% of individuals who received LTZ and 96% who received ART remained virologically suppressed. CD4 cell count also increased for both groups at week 26. The most common AEs included injection site reactions related to administration, and there were no serious adverse events related to LTZ. Lastly, the company presented results from a Phase 2a trial, NCT 05281510, as part of efforts to discover a cure for HIV. Results presented showed that the investigational TLR7 agonist, Visatalimod, was well tolerated with no treatment-related serious AEs. The most common AEs included infusion-related reactions.